to another of our talks at CHWB, the Center for Health and Wellbeing. I'm Dr. Lam.
And I'm Dr. Nevitt.
Welcome to our SIBO talk today. And we're going to talk about small intestinal bacterial overgrowth. So Dr. Nevitt.
Sure. So Dr. Lam and I see many different conditions here at the Center for Health and Wellbeing focused on integrative and naturopathic medicine. Very commonly, something that we see amongst all gastrointestinal disorders is small intestinal bacterial overgrowth. So today we'll tell you a little bit about that, what causes it, the signs and symptoms, and how we treat it.
Perfect. So what are the causes that we see mostly about when it comes to SIBO?
Sure. So there's many different things that can cause small intestinal bacterial overgrowth, which is basically when bacteria that normally the majority of our microbiome should reside in our colon, our large intestine, occasionally can creep up into the small intestine where it starts to ferment food and can cause abdominal gas and bloating. So there's several different things that can cause this overgrowth to occur, from traumatic brain injuries, from having an episode of traveler's diarrhea that then seems to persist and cause symptoms moving forward, to autoimmune disease, diabetes, several different things. What else have you seen?
And drugs.
Right.
PPIs, immunosuppressants. A lot of people just take a lot of medication that they think, oh, this is for gas and bloating. And that ends up to be one of the causes for the bacterial overgrowth.
Exactly, and really identifying the root cause or causes of small intestinal bacterial overgrowth are key in treating it and preventing reoccurrence, which is unfortunately very common. So that's something we use to dive really deep into the root cause of disease.
Right. So when a patient comes to you, what are the symptoms that make you think this might be SIBO? What are the symptoms that you see most of?
So kind of the classic symptoms that we'll see is this abdominal gas and bloating that gets worse, particularly after eating. Mm-hmm. So often these patients will get worsening gas and bloating, sometimes distension. You feel like your stomach is bloated, and it gets worse throughout the day and then kind of resets overnight. It can present with either diarrhea or constipation, which varies kind of based on the bacteria causing the symptoms as well. What are some other symptoms you've seen?
Well, I've seen nausea. I've seen fatigue or joint pain because now they're not absorbing their food properly, and that's what's causing the gas and bloating. And so these patients have severe diarrhea, I have severe constipation, but in addition, I have joint pain, I have fatigue, I have nausea. And so weight loss is another thing that I've seen as well. And so these are the patients that come in and it's like, I've been to several doctors and they've just given me this medication or that medication, and I've taken over-the-counter medications and nothing is really helping me. And so that's when I dive in deeper, and then we go into certain testing that we can do for this. But what are the differential diagnoses before we go into testing? What do you think other than SIBO when a patient comes in and says, these are my symptoms, doc, what can you do for it?
Right, so one of the first things that would be important to look into would be what foods are causing symptoms. With SIBO, it's often things like carbohydrates, beans, nuts, things like that are FODMAP foods or fermentable foods. Mm-hmm. Other than that, foods could be sensitivities. You could have an intolerance like a lactose intolerance. You could also have decreased stomach acid production, H. pylori, or just an imbalance of bacteria like a leaky gut in your large intestine, but maybe not in your small intestine. What else do you think of?
I've also seen systemic infections like candida, yeast infections that have similar symptoms in patients. And so I always do testing to differentiate. And so that brings us to the next thing we talk about is what kind of testing we do here at the center to help assess you further, more than just the regular testing that you probably are used to with blood testing. So what are some tests you do for these patients?
Sure. So I'd say the two main tests that we do would be either a SIBO breath test, which will test for both hydrogen gases and methane gases, or a stool test. And typically we'll do more of a comprehensive stool test that'll look at bacteria, yeast, funguses, and then specific bacteria that could be overgrowing as well. But sometimes it, really based on symptoms, we can have a really high suspicion of what's going on.
Right. Right, and so to be able to eliminate what foods, we can start patients on certain food diets that we do. Could be like the low FODMAPs that we do. There is specific SIBO diets that we do for patients depending on what the patient is sensitive to or allergic to, whether they're vegetarian, whether they're meat eaters. So that way they can go home with, okay, I can eat these foods and cannot eat these foods. So while we get the testing and waiting for the results, we can actually send them home with foods.
Exactly. So when we're starting to investigate what's going on, as Dr. Lam said, we don't wait to help you to relieve your symptoms. So typically, as we're waiting for these stool tests or breath tests to come back, we'll do about 4 weeks of a specific nutrition plan that will help to decrease symptoms that you're experiencing and can also cause some of the bacterial die-off as well.
Right.
And then after about 4 weeks, then we typically get test results back.
That's right. And so once we get the test results, now it's time for treatment. So what are the different treatments that you have tried? And I can tell you what I have tried for these patients too.
Great, always an opportunity to get to learn. So for treatment, there's a few different options. There's quite a few. There is antibiotic treatment that is targeted specifically to stay in the gastrointestinal tract. There's also antimicrobial herbal treatment that we've seen pretty effective, and there's quite a few studies showing efficacy of that as well. And then the third main treatment that I've used would be elemental diet. And that's a specific nutrient-dense shake that helps to decrease the bacteria and actually, kill off some of the bacteria.
That's true. So I have used the elemental diet before. So some people just be like, all right, I want to eat some food, and that's when I give a specific diet plan. But if they're fine with doing an elemental diet, which has all the nutrients in it, that way it sustains them during the time period before their test comes in, that's when I do the elemental diet.
Right.
But in addition, there's so many other antimicrobial herbs we can use, other nutrients and supplements we use it together with this. So SIBO, basically, there's so much we do with it, but again, it depends on a step-by-step process.
Exactly. As we were saying, yes, kind of having that methodical approach to things.
Correct.
And making sure you're always bringing it back to the root cause. So it could be decreased motility.
Yes.
Sometimes we'll use herbs to kind of help to move things along with that migrating motor complex. Could be leaky ileocecal valve. There's some visceral manipulation sometimes that can be helpful. Always making sure we address the root cause as well.
Yes. And so again, if you have had surgeries and you've had part of your colon removed or part of your small intestine removed, that can aggravate causes. So we are very specific, very personalized for your individual causes. So this is just an insight, a glimpse of what we do for SIBO patients. So if you're more interested and have all these symptoms and have had no luck with other things that you have done, then you are welcome to come and set an appointment with either Dr. Nevitt or myself and learn more about SIBO. And if you're interested more, put them in the comments so we can see and we can maybe perhaps do a whole webinar on this particular subject for you. So thank you very much. Signing off, this is Dr. Lam and
Dr. Nevitt.
see you.
See
Bye-bye.
ya.